Lung abscess. A lung abscess is a cavity in the lung that is filled with pus, usually due to a bacterial infection. It is usually caused by bacteria that live in the oral cavity. They then make their way to the lungs through aspiration, which would in turn infect the lung and cause an abscess. Lung abscess most commonly occurs in alcoholics, since they are more likely to accidentally aspirate their vomit. It also commonly occurs in people who frequently lose consciousness. Could be a side effect of drug abuse. These individuals can get a lung abscess since their cough, gag reflex, and other reflexes are decreased. This would in turn make lung clearing much more challenging. Causes of lung abscess include alcoholism, some medical procedures such as anesthesia and intubation, drug abuse, poor dentition, in other words, missing teeth, and some medical conditions such as seizures. Although most of the cases are of oral bacteria origin, note that people who are immunocompromised, especially those who are HIV positive, can get a lung abscess that is not of an oral bacteria origin. Other causes of infection include bacteria group that do not normally cause a lung abscess or some species of fungi. Mostly, one lung abscess develops as a result of aspiration or in a case of bronchi obstruction. This is seen in some lung cancer patients or in children who accidentally aspirate foreign objects. Several abscesses can develop if the organism enters the bloodstream in case of septicemia. This happens most commonly in people who inject drugs using dirty needles or unsterile tools. Some of the offending organisms of bacterial origin include Staphylococcus aureus, including methicillin-resistant, E. coli, Fusobacterium, and Mycobacterium tuberculosis. And some of fungal origin include Aspergillus, Cryptococcus, and Histoplasma. Symptoms include cough with a lot of sputum as a result of a rupture of an abscess. The sputum has a foul odor. Fever, fatigue, loss of appetite, and night sweats. Diagnoses include a chest X-ray, which would most of the times locate the abscess. CT scans will also 100% of the times locate the abscess and is definitely more accurate than an X-ray image. But the most accurate diagnosis is made through a biopsy, since the exact organism will be identified, and the patient will receive the most appropriate and specific treatment. Also, bronchoscopy will aid in performing a biopsy and in making a more accurate diagnosis. Treatments include antibiotics, which would be given both intravenously and orally. Start the patient on a broad-spectrum combination such as ampicillin sulbactam and clindamycin. In case the patient does not respond well to antibiotics, drainage of the abscess is needed, and sometimes other surgical interventions. If the obstruction is caused by a tumor or a foreign object, surgery is also needed. If the infection is of a fungal origin, give the patient amphotericin B and itraconazole. Continue the treatment until the symptoms disappear within 3 to 6 weeks and when the chest X-ray returns normal.